right, we're going to get this program started. And I want to let everybody know that my name is Stuart. I'm founder and president of MS Views and News. And the purpose of this series, MS Conversations Now, Patients' Voices, is to learn and hear from MS patients that don't not only do things for themselves, but also do things for others affected by multiple sclerosis. And whether they're a volunteer or they're doing it within their career. So tonight we have our guest, Susan Payrovi, and she's an MD, a doctor of integrative medicine and therapy. And also Susan is an MS patient. And this, I want to let everybody know that this interview is not scripted. So Susan has no idea what I'm going to ask her, not as of yet anyway. Unbelievable. You know, I've been wanting to have you online for quite some time, and there's so much to talk about. And I just want to get started, though, with you. So first off, hi, how are you?
I'm great. Thanks for having me on, and I'm so excited to be here.
That's fabulous. Hey, I got a quick question, and this is not personal or anything, but are you married?
That's not personal. Maybe.
Well, people might think I'm asking you a bad question.
Yes, very married with lots of kids.
Lots of kids. How many are the lots of kids?
3 boys that keep me really busy.
3 is not a lot of kids. I mean, I know families with 7. That's a lot of kids.
That's true.
Right?
Then I don't have a lot of kids.
I'm one of 3. I was never told that I'm from a big family. So, all right. So let's talk about you first. All right. Before we get into anything about what you're doing to help MS patients, tell me about your diagnosis. When did it happen? Were you married? What part of your career were you in? What were you doing at the time? Take it away.
Sure. I had just finished residency. I had trained in anesthesiology. I practiced for 4 years. I got married and I had a child, and it was after the birth of my first child that within a month I noticed my arm just wasn't quite working like it used to, and it didn't really show up until I went back to work a little early. And in anesthesia, we use our left hands, left arms a lot, and requires a lot of strength. So I couldn't do procedures that were actually pretty easy. Couldn't hold my arm over a sterile field. I didn't want to hang IV bags. And, you know, I had a young child, and it took 9 months to get diagnosed because I kept getting turned away because I was a new mom. I was stressed. I wasn't sleeping enough. I did have wrist tendonitis. So there were many ways that we kind of gave excuses to make it go away, but it wouldn't go away.
So, like, what were some of the things that you first actually noticed that was wrong with you that led you to even seeing a doctor? And I'm sure you didn't have MS on your mind. Even as a doctor, you probably had no idea that, you know, it could possibly be MS. So what were the symptoms that you had that first brought you to a doctor?
Yeah, I couldn't zip up a zipper with this left hand, especially. Just fumbling, couldn't play the piano. I'd take a shower, my left arm would feel like lead. It would just feel heavy and hang at my side. I would go for a run, and I just couldn't move my arm after using the arm. And and the symptoms would come and go. So one day I'd be like, I'm okay today. No, it's gone. I'm good. And then the next day it would be back. So it just kind of messed with my head for about 9 months. And MS was not on my mind at all until not a neurologist, but my plastic surgeon friend said, hey, you have MS. And the moment he said it, I was like, of course, this sounds exactly like MS. What was I thinking?
So what would you then do? You found a neurologist. And was that near to where you're living now?
No, and at that point, I had seen 4 neurologists who told me to go away, and one of them actually said, it's all in your head. He was right. But I ended up, after the plastic surgeon told me I have MS, I called my primary care doctor, and I said, hey, listen, I think I have MS. I need an MRI. And she said, no problem, ordered it, got the results, and there it was.
Right. Okay. So can I ask, I know it's terrible to ask a person how old they are, especially a woman, but can I ask how old you were when you were diagnosed?
That's a good question. I got to work backwards. I'm 47.
Oh, I didn't want to know that part.
Well, I have to do the math. 35, maybe. Okay. 35. Yeah, all something right. Like that. Mid-30s.
Sure. So that's like a prime time. So at what stage of your career though were you in when you were diagnosed, and what did you have to do? I mean, was it, you were talking about that you had problems with zippers. How was it to be doing what you were doing?
Well, I had gotten pretty good at doing anesthesia. In fact, I had always picked the hardest places to work at. I worked at a trauma center near Los Angeles where I could do gunshot wounds all night long. I was working 100 hours a week. So, at that point, things should have been very easy, but I was having difficulty intubating small children where I would, anesthetize them. They're no longer breathing, and now I have to put in a breathing tube, and I don't have strength in my arm to do that. So I was constantly calling my colleagues to come in and bail me out. And after the fifth or sixth time, it sort of occurred to me that like something's wrong. This was not hard. Why is this so hard for me? So it was after 4 years of practicing anesthesia, something I loved, I had to do a complete, 180. I had to quit anesthesia. It wasn't safe for me to be working in the operating room by myself. I ended up training in hospice and palliative medicine because I was always fascinated by death and dying and that process. And then I went on to do many other things because I could no longer practice the thing I studied for 4 years.
So mentally though, for knowing how much you loved doing what you were doing, how did it make you feel to have to seriously abandon that to go on to something else?
Yeah, it was not my plan, to have to redirect my entire life. So the first 6 months were really hard. I remember like going to department stores and Target and just walking the aisles, like trying to clear my head. Because at the time I hadn't even told my mom who lived with us. So I just needed to be out of the house. But, it took about a year, 6 months to a year where I could start thinking clearly and realized, well, I have a unique skill. I'm a physician. There are other things I could do. And how can I be of use to myself to try to get my health better, and how can I be of service to others? So beyond that, I went and trained in many other things, including integrative medicine, functional medicine, Chinese medicine, and acupuncture, trying to kind of figure out what is the stuff I didn't learn in medical school. Because, we place blame on our doctors when they don't talk to us about nutrition, lifestyle, but here I was a physician and I didn't know those things either.
Okay. So first, before we get into what you're doing in a career, even though you gave some hint about it, tell me ways that you found to like conquer your own MS.
I'd say the most important thing was that this mindset developed in my head. My husband is very supportive. And, we talked through a lot of things. So having a person to bounce like ideas and feelings off of was really helpful. And I got this idea in my head that if I worked really hard to improve my health, that I'll be okay. Because for me, it was very scary with a young baby to think that I couldn't take care of my child, I couldn't take care of myself. So my commitment to myself became, what is it that I need to do to get to that place that I want to maybe be in 20, 30 years? How do I end up having a healthy brain? And as I learned integrative and functional medicine, I started putting those things into practice. So every single day, I do those small things, those small decisions that get me to that place where I think that I'm going to move towards greater health. But, initially it was just 1 or 2 people that I confided in for the first 2 years. It was too scary to speak those words out loud, right? Because you can't take it back once you tell people you have the diagnosis. And I had this hope that I would return to anesthesia one day, but after about a year or two, it became pretty clear to me that that wasn't going to happen. But it was just finding my new normal and really exploring, talking to my husband and best friend about what my plan would be, and that helped me formulate my plan, my path forward.
So now let's get more into the True Medicine. True Medicine. This is Susan is co-founder and chief scientific advisor at True Medicine. And my first question for you with that is, what was the inspiration behind launching the True Medicine MS program?
So clinically, I've been working with patients with MS, autoimmunity, cancer, cardiovascular disease at Stanford. And I was seeing patients individually. I wanted to reach more people, so I started doing group visits at Stanford. And that's what I currently do in my clinical practice. But I still needed to reach more people because this information around lifestyle and what we can do now to help improve our health is so important, and it's missing from our conventional care of our patients. And so in an attempt to reach a broader audience, and of course, MS is my favorite audience, I decided to put together an online wellness program and do it in a way that didn't have the limitations of a clinical practice. And so over the last 3 years, I've been thinking about how do you teach lifestyle habits? How do you actually help people implement them? Because we're trying to do is habit change, the hardest thing that I think any of us attempts. And so this comes from just my need to share this information with other people because it's been so profoundly important in my own health and recovery. And I get to see it in action when I work with patients in the clinic. There's no doubt in my mind that this is the biggest missing piece of MS care. So my goal is to share that with anybody who maybe doesn't have access to this information through their neurologist, primary care doctor. You know, seeing an integrative or functional medicine doctor out of pocket is expensive. And I feel that this is information we shouldn't hide behind expensive providers. So my goal is to share it with whoever's willing to listen and to open their heart and mind to thinking about their health differently.
Okay, before I go into other questions, how do people find True Medicine? How do they find your website?
Yeah, truemedicinems.com.
Okay,
I'm also
so it's not just True Medicine.
Yeah, and also on Instagram and Facebook and YouTube.
Okay, so some of the programs, though, that you're running, can you just be a little bit more detail about all of that?
So I wanted to create something for everybody. Not everybody is ready to jump in both feet, and just go full force. So I have 3 main programs at the moment. There's a 12-day MS detox challenge, food-based, nothing extreme. We're just focused on behaviors and food. And in 12 days, people tell me they can walk better, their anxiety is better, they have more energy. So 12 days, that's a short-term commitment. Then there's the 6-week gut restoration protocol where we work on gut health. And, as ancient forms of medicine tell us, gut health is the foundation of good health or ill health. So in 6 weeks, again, we take a food first, lifestyle first approach to improving the gut so that we can improve the immune system. And then there's the 12-week Live Well with MS Foundations program. This is your 12-week lifestyle program where you go through learning about the mind-body connection, nutrition, sleep, movement and exercise, and then the one topic nobody really talks to us about, toxin awareness. Everything I teach is evidence-based. I pull in a lot of the data from the scientific literature because it's important for us to know the why behind the things we're being asked to do. So there's something for everybody, and it's really fun. We work in a group. There's a community. We meet every Saturday morning in a Zoom call, and there's online forums and lots of ways for us to engage with our participants. I work with Coach Dr. Roberta, so she and I head the program and help people implement the things that we know work.
Okay, thank you. What are the most common toxic foods?
Common toxic foods. Well, I will say anything that's not natural. So foods that are processed, packaged, sugar, especially the artificial sugars, artificial flavors, colors, natural flavors. So our bodies weren't meant to come into contact with these chemical compounds that are not natural. So anytime you can keep those things out of your body, it's a big win.
I heard somebody recently say that if you hear of international foods all by the same name, it's not really good for you. Like the word McDonald's, and associating that McDonald's is a food choice, a food brand. It is, but it's the same name all over the world, so stay away from it or anything like that. Anyway, let's go on to something else. Tell me about your program that I see that you're launching. I think it's next week on the MS gut restoration protocol.
Yeah, so that's the mid-range program, the 6-week program. And this is really fun because we do the protocol that's actually pretty big, hard to do on your own, expensive to do with a provider, but we do it together in a way that's in bite-sized pieces. We do an elimination diet because people who have autoimmunity often have food sensitivities as well, because the root cause of those two things is very similar. It starts in the gut. And so if we can start removing things that are damaging from the gut, like food sensitivities, then we can start to make progress. And, we just finished the 12-day MS Detox Challenge. And in 12 days, we had people say, like, my normal bowel movements are every 4 to 5 days. I'm now going every day. We didn't do anything magical. We just added foods and some behaviors. And then, the body started cooperating. So we take that model for the 12-day challenge and we blow it up into a 6-week program, and people make tremendous progress by the end of the 6 weeks. So less pain, less anxiety and depression, more energy, MS symptoms improve. So it's just a fascinating process to watch, and I'm really excited every time we get to do it.
Thank you. Are people that are lactose intolerant considered food sensitive?
That's a great question. There's different types of food reactions. So you have IgE antibodies that are anaphylactic. You eat the food and in 5 seconds, you're about to die. Mm-hmm. Then there's food sensitivities, which are IgG antibodies. They're slower to react, slower to come on. The symptoms are not as severe. And those are the antibodies we're talking about when we talk about food sensitivities. And they're typically, against foods like gluten, dairy, corn, soy, eggs, etc. And then lactose intolerance is actually not mediated by the immune system. Basically, as we age, we lose the enzyme that breaks down lactose. So we get gassy and bloated after we eat dairy.
Okay, thank you. All right, so going back to some of the things you mentioned earlier, you were mentioning different types of medicines that you were talking about, and one of them you hit on was Chinese medicine. Can you tell us what Chinese medicine is actually all about?
Chinese medicine's fascinating, and I'm actually really excited that we're doing a whole series through True Medicine on Chinese medicine for anybody who wants a different lens to think about their body, health, and disease. So Chinese medicine is a beautiful system of medicine that looks at the body as a whole, rather than assigning an organ to different doctors. And what you're trying to do is to balance the body through the flow of energy in the body. And in Chinese medicine, we call that qi. So through various behaviors, foods, or the insertion of needles in the body as an acupuncture, you can start impacting how energy flows through the body. And there's a Chinese medicine diagnosis is actually very complex. After taking a history, they might look at your tongue, they might check your pulse, and it's nothing like how our Western doctors check the pulse. It's very complicated, but they get a sense for where your body's at in terms of your different organ systems or meridians, and from there decide what the therapy is. So it's very holistic. It's about rebalancing and harmonizing the body and giving the body what it needs to be nourished. So I find the theories in Chinese medicine just really fascinating, and people who start working with traditional Chinese medicine practitioners who do acupuncture or herbs actually make great progress. There's a lot Chinese medicine can do for autoimmunity. So it's something I highly recommend to people who maybe haven't made as much progress with their Western medicine. And many of these things can be done in conjunction with your DMTs or whatever you're doing with your neurologist.
Okay, thank you. Before I go on to the next of my question, I'm going to take one from online, and that is, would your program benefit me, she says, as I have been fighting ovarian cancer for 3 years now?
I'm sorry to hear that. That's a really hard diagnosis. So, the things that I teach in the program help everybody. However, we do have an MS twist to everything. So as long as you have an MS diagnosis, you can join the program, and not only will it help MS, but it'll help everything else, because the secret is even though I've wrapped up this program into an MS based program, it would really not be that different if I were to do it for heart disease or for cancer or for something else, because good lifestyle habits help everything, maybe with some small twists here and there, but the majority of what I teach benefits everybody.
Okay, thank you. Next, what do you feel the impact has been on the community you're working with, specifically the MS community?
Sure. You know, one of my biggest gripes is that lifestyle medicine is not a part of our conventional care, even for our centers of excellence for MS, where we kind of have a multidisciplinary approach. Integrative and lifestyle medicine is missing from that approach. And if I can bring this information in so that people understand that there are things we can all do every day, starting today even, to impact our health, that I think makes us feel more hopeful about our diagnosis. We can start changing things in our environment today, like the foods we eat, how many hours we sleep, whether or not we move our bodies, and how we manage stress, and actually cause real-time changes in our body, down at the level of the cells, the biochemistry, the genes. And unless you are bringing this into your own care, you're not doing enough for your MS. I really believe in that. I've had the personal experience, and I've worked with patients who have benefited greatly. And what I love about lifestyle medicine is that it's accessible. I don't ask my patients to do things that are expensive, because the majority of my patients can't do things that are expensive, and expensive things aren't sustainable long-term anyways. So we just use common sense behaviors and medicines and food to get lots and lots of progress over time.
Thank you. So if somebody wanted to know more about integrative medicine, what would you tell them?
Well, if you want to know about integrative medicine and MS, you can look at our website and our social media. I put a lot of information out there that brings in the functional medicine and the integrative medicine perspective of treating MS. There are great organizations out there. There's the AIHM.org. That was my first experience with integrative medicine, and it changed my life. So they do a lot of wonderful programs. You can find providers through their website. And then there's functional medicine, which is actually different than integrative medicine. It's a system of looking at the body through different systems of function. So we won't go into depth about that, but the organization you'd want to look at is IFM, the Institute for Functional Medicine.org, and they're wonderful as well. So, there's a lot of doctors online who, do a lot on social media, and many of them are trained through IFM and the AIHM.
Okay, thank you. There are people online that would not know the difference between integrative medicine or functional medicine. Can you tell us the difference, please?
Okay, well, now I will tell you if you want to know. So integrative medicine looks at lifestyle behaviors and how they impact health. It's evidence-based. We look at the body as a whole, and we treat not just the physical, but also the mental, emotional, spiritual aspects of a person. Same goes for functional medicine, but functional medicine also has a different paradigm at looking at the body. So it looks at systems of function like energy production. So what are all of the different things involved in your body producing energy, extracting energy out of food, converting it to an ATP molecule so you can move your arm, get your brain to work. So that's one system. Another system is defense and repair. What are the body's systems involved in protecting itself? So those would be a lot of immunologic activities. Then there's this system called assimilation, meaning how do you bring external things from your environment into the body? Mainly this involves gut health. So how do we take food, that's something external, and then break it down and allow it to enter the body? So even though we mainly talk about gut health in that system, same goes through for things coming in through skin or things that we breathe in. So anyways, there's 7 different systems, and it's just a different lens to look at a patient sitting in front of you who's very complex. easy patients never come and see an integrative medicine provider or a functional medicine provider. I always go, I just want that patient whose foot hurts, like that's all they want to talk to me about. It's never happened. My patients come in with, 3 autoimmune diseases, a history of cancer, fatigue, fibromyalgia, brain fog, thyroid's not working, they have insomnia. The list is long. The medications are many, and so are the supplements. So it's a very complex situation. And so functional medicine actually is very useful to me in kind of stepping back and going, where do I want to first start working? And I'll tell you what, when I have really complex patients and I don't know what to do with them, and I don't know if that's a surprise, but sometimes we actually don't know what to do. So you start at the gut. If you can help improve somebody's GI tract, where they can absorb and digest better and their microbiome is healthier, they just start feeling better and they start making a lot of progress. This is why I developed that 6-week gut restoration protocol, because you can make tremendous progress just by addressing the gut.
Great, thank you for that. Next, by the way, that was really good. I know a lot of people that are going to want to know more about what you were just speaking about with the gut microbiome and its connections, all right? So a person from online is asking, as you practice and teach integrative medicine, do you personally take a DMT as well? DMT, for those that don't know, is a disease-modifying treatment.
Great question. So I don't, but I also want to back that up with why I don't. I got diagnosed after the birth of my first child. My neurologist thought my symptoms were mild enough. Even though it ended my career as an anesthesiologist, they were still mild enough. And if I wanted to continue nursing my child, that I could do that and stay off of DMT. And I kind of got this aha moment of like, oh, okay, if I can stay stable and keep nursing and keep getting pregnant, maybe I could stretch this out and see how things go. So I went on and had 2 more children, nursed each of them 2 to 3 years. And at the end of 10 years, when I went in to see my neurologist, and I said, okay, I'm done. What are we doing now? And he said, you've had 10 years of stable lesions. Your symptoms have improved. I'd like to keep watching you. And that actually was what I had been hoping for. And I couldn't believe that that's what he was telling me. But, I also want to say that, if I were to have a relapse, I will go right into my neurologist's office and get a DMT and do whatever I need to do to protect my brain. But I have, and as a commitment to myself and to my family, I've decided that I'm going to exercise every day, eat a certain way, and do all of those things to the best of my ability. I don't always do them perfectly, but hopefully that will get me a healthy brain as I age.
Okay, thank you for that. Can you share with us what you feel is a good diet and or nutrition for people living with MS? How does that appear? What does it look like?
So there's so many diets out there for MS, right? There's Dr. Walls, McDougall, Swank. There's many, paleo, ketogenic. I think I always like to not have a reductionistic approach. I like to step back and go, what do these diets have in common with each other? And then that's the diet I talk to patients about. So it's a whole foods, plant-based diet. The whole foods part means you're eating foods that are unprocessed, unpackaged as they grow in nature. The plant-based part means that you're eating at least 80% plant-based foods. You don't have to become a vegetarian or a vegan, but I do want you to eat mostly plants, because all of the data shows that plants are going to flood you with healing molecules, phytonutrients, which are those colorful molecules you see in fruits and vegetables, and they help create that healing environment in your body. So a whole foods plant-based diet, eating organic and non-GMO as much as possible, cutting down sugar, and including prebiotic and probiotic foods in the diet. And these 2 things are going to help boost your microbiome, which I know everybody loves to talk about. Prebiotics are foods that have a lot of fiber that our good bugs can use as fuel. So these are foods like garlic, onion, kiwi, artichokes, bananas. And then probiotics are, you don't like bananas?
No, I love bananas. Some of the other things you mentioned, though.
Probiotics are the foods we eat that are fermented that contain the good bugs. So they could be fermented dairy, but it could also be fermented vegetables, kombucha. If you can get these things into your diet every day, you'll start building that gut health.
Okay, thank you for that. Speaking about all these things you were talking about, sugars and etc., what about for people, and I know it's bad, what can you say for people that are using diet drinks and how that might be affecting them?
Not good. I always joke with
what is it doing to their brain?
So, okay, if it depends on, there's so many different kinds of sugars that could be in drinks, right? I almost rather you drink like Mexican Coke that has like cane sugar in it. At least it's real, right? And I always tell my kids, I go, no, not high fructose. You can get if you have to get a drink, get the one with the real sugar, not the high fructose corn syrup. But the artificial sugars are actually quite damaging, not just to just your overall health, but specifically they can damage your microbiome. So the good bugs can go out of balance. They can cause inflammation in the gut. Some of them, there's some evidence that they are endocrine disruptors, and endocrine means hormone. They disrupt hormone function in humans. In fact, some of these that are artificial sweeteners that are directed towards diabetics can actually worsen blood sugar control over long-term use. So it's really, again, like if I go back, you asked earlier, what are some of the most toxic foods? And I said artificial foods. Artificial sweeteners fall under that. And of course, even sugar sort of hijacks your brain. You eat sugar, dopamine release, which makes you want to do that behavior that caused the dopamine release. So you keep seeking more sugar. And, it's a hard cycle to interrupt, but it's really important because there's no nutrients in sugar. It's just going to fan the flames of inflammation, and it's empty calories.
Okay. All right. New subject, sort of. Tell us about brain health, since we're feeding into that anyway.
Yeah. Do you want to know the supplements or the medications that improve brain health?
Okay.
Because there aren't any. So
what are the foods that increase brain health?
Yeah, the whole foods plant-based diet. Look, there's no shortcuts. I've looked for them. If I knew the shortcuts, I'd be using them myself, but there aren't any shortcuts. So diet is important, but I'll talk to you about two other things that might actually even be more important. Can you take a guess of what they might be?
I'm not guessing. I'm not a good guesser.
Okay. Sleep and exercise.
Oh, no way.
Absolutely, 100%. In fact, I think people always want to focus on nutrition because it's the most important, right? I don't know if it's the most important. I might actually pick sleep as the most important, which I know might be like shocking to some people, but sleep is the foundation that all the other lifestyle habits rest on. So if you are chronically sleep deprived, getting less than 6 hours a night, you may be undoing all the good work you are doing with a good diet, with stress management, meditation, or whatever else you might be doing for your health. So sleep is super important. And when we sleep, our nighttime physiology turns on. So for example, the brain will start detoxing or detoxifying, moving damaging things out of the brain much more efficiently, maybe even twice as fast as it happens during the day. So when we talk about dementia and Alzheimer's and Parkinson's, which we think are due to toxins getting in the brain and then the brain creating an inflammatory reaction to that thing that got into the brain, and then that inflammation goes on and damages the brain. If we can just work upstream and get the junk out or not let the junk enter, we'll actually make great progress. And if we can sleep at night and allow there to be adequate time for the brain to move this stuff out, then we'll make great progress. So sleep, I would say, is number one, 8 to 9 hours a night. I know that sounds impossible to many people listening to right now. And I'm a person that did 5 to 6 hours up until just a few years ago. But it's possible. It's a mindset and it can be done. That's actually what your body's programmed to do. And then the other thing is exercise. When we exercise, we turn on all kinds of anti-inflammatory molecules. So, we try to put in a lot of supplements in the body to turn down brain inflammation, but we don't really know if those supplements get into the brain to actually improve inflammation. But exercise does. reduces brain inflammation, turns on a molecule called BDNF, brain-derived neurotrophic factor, helps the brain grow and thrive and make new connections. So do I love getting on my treadmill every day? I mean, I do love it now, but I didn't love that for many years. But now when I exercise, I think of this like halo of BDNF surrounding my brain. And it's not just when you're exercising, it follows you for sometimes even a day, day and a half after that episode of exercise. So sleep and exercise are probably the top two things that are going to keep your brain healthy. And then, cutting out the sugar and eating the good foods and the healthy nutrients. And of course, not smoking, not putting the alcohol in the body every day or frequently, because again, that's a toxin, right? So these are just behaviors that we have to work on if we truly are committed to having a healthy brain well into our, older years.
Great, thank you. When you spoke about the sleep, 8 to 9 hours a night, are you saying complete, straight through 8 to 9, or is 4 plus 4 okay?
I mean, if it needs to be 4 plus 4, I'm happy. It's better than 6 in one stretch, maybe. I don't know. I don't know if there's data on that. But I'm reading a wonderful book by Matthew Walker called Why We Sleep. It's fascinating, and it has changed how I go through my day, because from the moment I wake up, I'm planning how I'm going to get really good sleep that night. So humans are sort of programmed to have one long stretch of sleep at night with a short one in the afternoon called a nap. And I know a lot of people don't want to nap because it makes them feel lazy or, they're too busy, but you're all allowed to have naps. I know people sometimes just need permission. You have permission. But ideally, if you can get one long stretch, it's really useful. But even if it's broken up, that still helps.
The reason why I'm saying that broken up sleep is that for most of us with MS, or most of us getting older, we do need to go potties in the middle of the night. It's there. And so there is going to be broken up sleep. So, and a lot of times you get back into bed and oops, you made a mistake. You picked up your phone to see what's going on, right? And then it could be another half hour or so before you get back to sleep. So, there is that flaw that people have these days. And I know you're going to tell me to pack the phone up and put it in another room, right?
Well, can I tell you what I did? So about 10 days ago, my 7-year-old, I was sleeping next to him, and he goes, Mommy, you tell us not to use devices. Why do you sleep to a podcast? And I was like, because I'm an adult. But that was such a crappy answer, right?
Right.
So tonight will be my 8th night of no phone in the bedroom. And the excuse I was using was, I need it for the alarm in the morning. But, I'm looking at my phone in the middle of the night. And now I'm interested in whatever it is at 3 a.m., right? And scrolling. So I've actually slept, of the last 7 nights, 5 of them I've slept through the entire night. So I don't know. It's an experiment. Try it. It's hard, but I did it. I'm going to continue doing it.
Good. Thank you very much. All right. Next, what do you recommend for people who are looking to improve cognition, memory, and stress management?
Beautiful question. So cognition, our ability to think, responds to all of the things that I said respond to, that brain health responds to. So sleep and exercise would be my top 2 things. When people start having brain fog, short-term memory issues, they're leaving their stuff all over the place, they can't get organized and get things done. Get more sleep. Even an hour more of sleep will help. And do the experiment. Don't take my word for it, because I can tell you, when I haven't slept good the night before, I'm a mess. I'm all over the place, right? And so sleep and exercise are the top 2 things. Brain games are really useful. So it could be Sudoku, it could be crossword puzzles, it could be like working on a jigsaw puzzle, learning a new language, really just using the brain. There are paid programs online. What is it, Lumosity or something? I don't know. I find them a little bit expensive, but anything you can do to challenge your brain will go a long way. And decluttering your life. The more you are scheduled to do a million things, like the harder it is just going to be for your brain. So give yourself that afternoon nap, say yes to less things, and only commit maybe to 2 or 3 events throughout your day, and then you're done.
Impossible for me. Impossible for
Impossible.
me. Sorry to say,
No,
impossible.
no, but
And
we can do.
what's that?
I said, I have 3 kids and I do a lot of other things, and I've learned to say yes to less things. I don't volunteer for everything at school anymore. I don't like raise my hand every time somebody asks for help. I just do the things that I'm good at, and I let other people do the other stuff.
Okay, that's cool. All right, so they're going back. So let me ask this other person's question first. Exercising when you have MS pain. Are there any suggestions? It's difficult to be motivated to exercise when you're in that much pain.
That's a great question. And MS certainly poses a lot of challenges because of pain, fatigue, weakness. I would challenge you to find a way to move your body that feels good to you. You don't have to go and run a mile. You do what your body is capable of, and I think you start really nice and easy and slow. And tap into your benefits if you can access a physical therapist to help you get started. You can do simple things like resistance bands. You could buy a set for like $10, $15. Use the loosest one and just start moving your arms. You could put them between your ankles and move your ankles. There are these peddler things, like you just put it down. It's like a bike, but you just pedal. Or there's a hand one that you could do. Start easy. Maybe even do gentle yoga. There's a person online that I love, Yoga with Adrian. It's all free. It's a wonderful resource. I mean, there's so many wonderful people out there, but put in gentle yoga and just start moving your body. I know it sounds awful to tell a person with pain or fatigue to go and exercise and move their bodies, but the data shows that if you move your body regularly, you will have less pain and fatigue.
Correct. We have physical therapy online once a month. It's all free. Okay. And we also have Pilates online once a month. It's all free. It's been happening now for 3 years, each one of them. So you need to go onto the MS Views and News website, see when these things are happening each month, and get involved with it. As far as that pedaling machine, I got one. It's not really a machine. It's free. I mean, it costs money to get. It's not free. All right. But you can design your own level of how you want to do it. You could tighten it up and make it a little bit stronger to do, or you could just do it slow and softly. I started off doing it just for 5 minutes, then 10 minutes, then 20 minutes. The next thing I knew, I'm doing it for over 30 minutes a day and not even really paying attention that I'm doing it. I'm just doing it. You get into a rhythm. You just get going with it. And it feels great. It feels like I did something, even though I really didn't do much. All right. But yeah, I got that halo over my head while I'm doing it.
You got your BDNF halo.
That's right. That's right. All right. So let's talk about something else. Going back to what you were talking about, nutrition and the different diets. What can you tell us about the intermittent fasting diet?
Okay, I love fasting. It's a game changer, and I think it's one of those tools that we use in integrative and functional medicine that really pulls people in, because once they start doing it, they love it and they want to keep doing more. Now, you said intermittent fasting, which I believe you might be talking about time-restricted eating. Intermittent fasting is what people call that overnight fast. Anyways, there's some semantics there. With intermittent fasting, you're supposed to restrict calories, but I don't think that's what we're talking about here. I'm going to talk about the overnight fast that people call intermittent fasting. So it's actually a wonderful way to treat your GI tract throughout the day and at the end of the day, because our modern way of eating, where we're grazing throughout the entire day, we have 3 meals, we have snacks in between, we eat at the end of the night. What's happening is the GI tract is constantly tasked with breaking down and absorbing the food that's coming through. So the GI tract's not really getting an opportunity to tend to, cleaning up the GI tract, repairing and rejuvenating the GI tract, the cells that line that area. So as you can see, if you can give the GI tract some empty periods, now you can do that work of repair. And so that's what a fast is, when you stop putting food in your body and your GI tract can rest and do those other functions. So one of the gifts of the pandemic to me and my family was the realization that you do not have to eat 3 meals a day. I had small kids. We went to 2 meals a day, and it even worked for our family with young kids. So 2 to 3 solid meals is ideal. What I prefer people do is to finish eating early. Give yourself at least 3 hours between the last solid thing you put in your mouth and the time you go to bed. That gives your upper GI tract an opportunity to empty. And now when you go to bed, you're actually going to have higher quality sleep. You're going to get more restorative sleep. Memory is going to improve, learning is going to improve, and the GI tract is going to have a chance to repair itself. And so this overnight fast, typically people say to start with 10 to 12 hours of not eating, and you could do that while you're asleep. So let's say you finish eating at 6, you're in bed by 9, you wake up at 6 a.m., that's 12 hours, okay? So now you've done this wonderful thing for your GI tract. As people get comfortable, they'll start lengthening it to 13, 14, 16, 18 hours. I just caution people, if you're fasting overnight and you feel a little bit depleted or cranky or hungry, just eat. It's not a big deal, right? Don't be a hero, I always say. So break your fast when you need to break it. But if you can do 12 hours of overnight fasting 4 to 5 times a week, that goes a long way in setting your cellular health straight. So what happens is inflammation in the gut comes down. The immune system becomes less dysregulated, so it brings regulation, less autoimmunity to the immune system. Cells, older, more dysfunctional cells in the body are moved out, making room for healthier cells to come in. There's just so many wonderful things that happen just by this act of not eating all the time. Now, the trick is the earlier dinner. So yes, you could eat at 10 o'clock and then go to bed and then have breakfast at 10 a.m. or later, but it's not the same as doing it shifted earlier in the evening. So go to bed with an empty stomach. It just takes a week or 2 to get used to that 3-hour window between dinner and going to bed. So start there. And then the only thing I'd caution you all about is if you're diabetic, you have high or low or unstable blood sugars, you're on blood sugar medications or supplements, please don't fast until you talk to your doctor, because all of a sudden you stop eating and you're taking your medications, your blood sugars can plummet and you can die. So please talk to your doctor before you start a fasting regimen.
Sure, thank you for all of that. And we have heard of people that only eat from noon until 8 p.m. We've heard of others that actually will eat their breakfast and they'll eat an early lunch and they stop eating by 1 o'clock in the afternoon, and then they don't resume again until like 6 o'clock in the morning. So that is a little radical, very radical. There's no way I could do that. I wouldn't even think about doing that, but that's my story, okay? We're not counting on everybody else to do that.
I challenge.
I'm not doing it.
You know
I'm
what?
not doing it. You can challenge me all you want. I'm not doing it. That's like saying, Stuart, try to live without your phone for 24 hours. It's not going to happen.
Oh boy. Oh boy. We got to do something with you. You know what? I think it's a mindset. And when you hang out with other people who do it, all of a sudden it becomes possible. The thing is, people feel so good that they go, oh, I'm going to do it. And it wasn't as hard as I thought it was. You know, I worked my way up to 24-hour fast, didn't think I could ever do it. But I learned that if I have an early dinner today, and then I skip breakfast and lunch tomorrow, and then an early dinner tomorrow, that's 24 hours. So there's ways of doing this that are doable. And you'll be surprised that hunger is not really the thing that's on your mind. So anyways, just things to consider.
That's right. Well, when people tell me I have to fast for Yom Kippur or the Jewish holiday, it's very difficult, okay, because I have to do it. But when I don't have to do it, and I could go days without eating, and I don't even think about it. So, but that's when you're not told that you don't have to do it. So.
Okay, you don't have to do it, and you don't have to keep your phone out of your bedroom.
Thank you. Okay. All right, that's fabulous. All right, next, another question, a little bit difficult. I'm going to see if you can pull this one out and try to explain this one. Person is asking, or person is saying, if there's damage in the reticular activity system, the RAS, do you have any recommendations on how to deal with this without medication? And from what I've learned, everybody, this RAS has something to do with your brain and how it controls your waking or your wakefulness.
I'm shocked that I actually remember what the RAS is. I don't think I've had to think about it since medical school neurology, but the reticular activating system is involved in the onset of sleep. And so I would say, it depends on what the damage is. Is it due to MS? Is it due to something else? It could be due to tumor, due to, whatever, a stroke, for example. I think that our brains are what we call plastic, okay? That means that it can regenerate, it can form new connections. So depending on what the damage is, how long it's been there, how extensive it is, it might be possible to improve that area, but I wouldn't know the specifics of it. Now, I think sometimes we as doctors give this crappy advice to people of like, no, I don't think you'll recover. In fact, that's what I was told about my left arm. Oh, it's been a year and you haven't had much recovery from with the MS. You're probably not going to regain a lot of, that function. Well, 7 years later, I did. I'm only 5-10% off my baseline now. So if it's important to you to work on improving your brain health with the hopes of improving the damage in the RAS, 100% keep doing it. And what do you do to improve it? It's sleep, exercise, good food, challenging the brain, and maybe working with a therapist who can maybe do some targeted therapy.
Okay, thank you. How do you feel an individual's lifestyle choices impact the way that they feel daily?
Oh, it's everything. 100% of what you do in your environment influences how you feel. And for people who haven't made that connection, I would urge you to try maybe eating a clean diet for a week or going to bed earlier and see how you feel. It's not until you clean things up and go back to your old ways that you notice the changes. But our bodies are so dynamic and we respond to our environment. And for those of us living with MS, we've all heard, MS is maybe 20% genetics, 80% environment. Where in Western medicine are we addressing the environment? I don't know. I mean, I don't think we talk about, changing one's environment when we go see a neurology doctor or even our primary care doctors. So what is the environment? Well, it's the factors and the forces that you're coming in contact with. So are you in a physically or emotionally stressful environment? What are the foods that are coming in? Are they natural, healthy foods or highly artificial processed foods, fake foods? Are you sedentary and staying in one position all day long, or are you moving? How are you managing stress? How are you sleeping? Are there infections, COVID, other viral infections? Now we know that EBV seems to play a really major role in the onset and progression of MS. So all of these things are environment. Some of it we can help, some of it we can't. But the things that we can help, like our lifestyle choices, those can actually create the healing conditions in our bodies. And sometimes people get on me about using the word heal. And I want to be clear, I'm not saying that we're curing MS. Unfortunately, that's not going to be possible in the near future. However, we can create a more healing condition in our bodies by the choices we make so that our body can move towards balance. So it's the same thing I'm talking about all the time: sleep, exercise, nutrition, stress management, avoiding toxins.
Okay, thank you. Are there things that a person could be taking or eating while immunosuppressed to help rebuild immunity?
Okay, if we're talking about foods, once again, I would just go back to eating lots of plant-based foods. I know I sound like a broken record, but really, truly, that's the answer.
Sound like a tree.
Yeah. Just lots of colorful foods, lots and lots of plants. And plants aren't just fruits and vegetables. We're also talking about beans, legumes, nuts, seeds, herbs, spices, herbal teas. Mushrooms have a lot of effects on the immune system. They are immunomodulatory, which is a word that means it impacts the immune system. It can dial up the immune system or it can dial it down. Sometimes we don't know which way it's going to do that. So while, taking medicinal mushrooms is not the topic we're going to talk about today because it's complicated, using it as supplements, you could eat, the more exotic mushrooms. About a pound a week. You go to your farmer's market, maybe skip the white button mushrooms and try the lion's mane, the reishi, the trumpet, oyster mushrooms, mix and match. They're really good for your immune system. But
You know,
don't
I was always afraid of mushrooms, after growing up as a kid and learning what's growing in my yard and how it could destroy you. So those are a different type of mushrooms, though. You don't know that one, do you? Okay, gotcha.
Oh no, I do. And I live at a place where we get those Alice in Wonderland mushrooms, and we have some trees where we think maybe psilocybin might grow. So we go out and look for it. We haven't found it yet.
Okay. For everybody that doesn't know what I'm talking about, you eat certain mushrooms and it's like it's a very intense high, and psychosis it could give you. So you don't want that. Just stick to the mushrooms that Susan's talking about.
Eat the ones source.
Exactly. Tell us what supplements you would recommend for a person with MS and why those specific supplements.
So I'm an integrative functional medicine doctor, and people come to me for supplements, and then they're always surprised when I say, no, take all these things off. You don't need all that stuff. First, you do lifestyle, and then the icing on the cake is the supplements. The non-negotiable supplement is vitamin D. Hard to get from diet. We are no longer going out with our skin exposed, so we just need to supplement. So talk to your doctor about what dose of what blood level of vitamin D is right for you, and then how much vitamin D do you need to get there. My approach with vitamin D is, again, ask your doctor, but I think a number around 50 to 60 in blood for total vitamin D is a good number. And then, pick a vitamin D dose in conjunction with your doctor, take it for 8 weeks, and then go get tested to see what your body did with it. So that's number one. In fact, I don't take a DMT, but I keep my vitamin D level nice and high, and that's worked for me. So it's an amazing molecule that actually brings more regulation to the immune system, which means less autoimmunity, less inflammation. Okay, number two, if I had to pick one, I would say maybe omega-3, although it's a distant second. Omega-3 from fish and even from algae, for those of us who don't want to do fish, can help lower inflammation. We don't have a ton of data in this area, but in other conditions, it has been shown to improve inflammation. So omega-3s from a high quality fish oil where they've taken out the contaminants like mercury. Other than that, it might be worth considering a B complex. B vitamins play a really important role in the nervous system, immune system, energy production, mood. So making sure you're getting enough B vitamins. If you're vegetarian or vegan, you want to be careful about getting low B12. So get your B12 checked, and if it's low, you will need to supplement because B12 mainly comes from animal foods. If you don't have a widely varied diet, maybe try a multivitamin, a good quality multivitamin. But those are the main things. I don't do a lot of supplements. I find that people who work really hard on lifestyle actually don't need supplements.
Okay, thank you for that. Going back to the vitamin D, people need to be tested before they just start using vitamin D, correct?
Everybody's low, so and insurance doesn't always like paying for vitamin D. So my approach is take it for 8 weeks, maybe start it at low dose, 2,000 to 4,000 units a day. Take it with food to help it get absorbed better because it's a fat soluble vitamin. So hopefully, if there's some fat in your food, it'll help it get absorbed better. Do that for 8 weeks and then go get tested because it's rare. I find people like in the teens, the 20s, maybe the low 30s when they're not on vitamin D, and it's such an important vitamin for immune health.
Okay, great, thank you. And by the way, living in Florida with all the sunshine doesn't help. We still have low vitamin D, so.
Because you're wearing clothes, sunblock, hat, and you're behind windows. That's why.
Exactly. All right. Next question is, what natural ways are there to help with pain and spasticity?
Great question. So again, the lifestyle habits. Some tricks I like are, I think acupuncture can be really useful for both pain and spasticity. There are supplements out there that are, touted as being helpful. I don't find them useful. Sometimes you could try, for pain, you could try turmeric, but talk to your doctor to make sure it's safe for you. It's a little bit of a blood thinner. It can upset the stomach, but turmeric, definitely eat it as food, as the root and the powder, but you may consider doing omega-3 and turmeric as anti-inflammatory supplements to lower pain. And I think acupuncture and Chinese medicine herbs are always useful for both of these conditions.
Thank you. And going back to sleep for a second, what do you tell people who want to use melatonin?
Ooh, melatonin's an amazing molecule. So it's always best to promote your own pineal gland's, release of melatonin, which means you got to be in darkness no later than 10 p.m. at night. So not under your home lights, not looking at a screen. That's what's going to allow your pineal gland to release melatonin. Now, if you already have a good bedtime routine in place, which means you do exercise during the day, I know that's not exactly bedtime, but that's what's going to help you get good sleep, and you spend some time outside, 30 minutes at least in the early morning hours, maybe before 10 or 11 a.m., that's going to help you do your bedtime routine to kind of ease into sleep. If you want to use some melatonin, that's fine. I just don't like any supplement long term, and without a good bedtime routine in place, melatonin won't work. I have overcome melatonin many a times when I've taken it and sat in front of my computer at 10 o'clock at night, not sleepy. So you got to put the brain in the mood to sleep, and then if you need a little extra help, go ahead and take it.
Great, thank you for that. So we're going to be wrapping things up here in a moment, and I want to ask you first, what inspiring words do you have for the MS community, other than eating plants?
Yeah, I won't say that again. I reject this idea that MS is unpredictable and we have no control over it. From my personal and clinical experience, I can tell you we have a great degree of control through the behaviors we engage in every day. And if you truly want to have a healthy brain, if you want to live with less anxiety, depression, less pain, less fatigue, it's worth putting in the time and effort to do the things that we know help. So getting the mindset that you have control over your future, your destiny, is really important. I think it's been one of the most powerful things that's helped me in my recovery.
All right. Well, thank you very much for all your time this evening, and we're going to end things like in 20 seconds. And again, you have another 3 hours to your day that we don't have because Susan's out in the West Coast, USA. And so enjoy your late afternoon and have a great night. We'll see you again soon. Thank you.
Thank you for having me.